Does the areola get larger typically from pregnancy or breastfeeding? Does that make it stretch, or just if the person gained a lot of weight, let's say, does it stretch, or are you sort of born with a bigger areola or a smaller areola?
Yes. So everything starts with genetics, of course, and then the size of the areola. Some patients, they're born with very, very small areolas that actually just barely go around the nipple. There are patients that are born with much larger areolas just from genetic or pedigree of areola. So just from there, that's where you start seeing differences. And then as the patient develops through puberty, then the areolar tissue tends to be differentiate more and more from the surrounding tissue, from the surrounding skin, tends to increase in color, tends to be a little bit more raised, tends to react a little bit more, and tends to grow, tends to dilate, tends to go bigger. And that's just for pure development. And then after that, it'll experience changes throughout life. On one route, you have pregnancy and breastfeeding. And of course, what that will do is it'll increase the size of the breast in general. And then that would increase the size of the areola. Also, as you know, the breast is also, there are two big components on a breast. One is fat and one is breast tissue per se. So when patients gain a lot of weight, if they have a significant weight gain, then their breasts are going to grow. And then the areola is also going to be submitted to stretching forces that can have that areolar tissue grow in size.
And does anything happen with that tissue during menopause? Like if it grew during pregnancy, could it shrink with with
With
menopause,
menopause, no,
or not really?
no, not really. We've never seen that. Of course, the breast tissue throughout life also, it's little by little the breast tissue itself gets substituted for fat, and
Hmm.
then the breast tends to start deflating and tends to like succumb to gravity and starts stretching a little bit more and becoming what we call a little bit more ptotic, a little bit more droopy. But in reality, the areolar tissue, since it has a skin component, once it has stretched, is really hard for it to go back.